As we've been reporting, the White House now says that the monkeypox outbreak in the U.S. is a national health emergency. Here to answer your questions about that is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Nice to see you, Doctor.
Hey, Dr. Malley. Thanks for joining us. So federal health officials believe that the monkeypox virus now poses significant health threat, their words to Americans. So in your opinion, what has changed in time?
Good question.
Well, really two things. The first one is that the administration has been criticized for what some have viewed as a very slow response to the MPX outbreak. And so I think this declaration, of course, is to try to change that sentiment. The other reason is that this declaration also means that significant resources can now be placed at the federal and the state level to try to combat this outbreak. And in particular, this means more treatment, this means more vaccines, and this means much better coordination between federal, state, and local departments of health.
So right now, the CDC has confirmed about 6,600 monkeypox cases here in the U.S. That's a small number compared to other viruses like COVID-19. The number of children who have been infected is even smaller, 5 cases since July. So do you have any information about how those kids were infected, how these kids are doing?
What we know, and a lot of this, of course, is limited by confidentiality, but what we know is that these cases, the 4 of the 5 were acquired locally, meaning in the United States, presumably by contact, could be as simple as a physical contact with a family member, for example, or a friend who had monkeypox lesions and then inadvertently infected the child. The 5th case came from a child who came from abroad, and so presumably that infection occurred outside of the United States initially.
Dr. Malley, as you know, many kids develop rashes for a million different reasons, right? So what other symptoms for parents, if they want to zero in, what about symptoms? What about clues that might lead you to suspect monkeypox?
Well, I think the first thing to point out is, as you did, is that there are very few cases that have been reported in children so far. So by and large, most parents should not be thinking that their child who has a rash is coming down with MPX because it's really very unlikely, statistically speaking. On the other hand, if there is a rash that looks unusual to the parents, something that really they've never seen before, that seems to be unusual, has some features that indicate maybe some vesicles, for example, which are typically seen in chickenpox, but can also be seen with MPX, then those types of clues should lead the parent to contact their healthcare provider. I think other symptoms such as fever and more generalized malaise, swelling of glands under the armpits, for example, all of those have been reported, but are really rare, particularly in children. We do worry especially about children under the age of 8, those who have eczema, and of course, anybody who's immunocompromised, because in those individuals, MPX can be much more dangerous.
Dr. Malley, thank you so much for being with us this afternoon. It's great to see you, and thank you for your expertise.
Thank you, Doctor.